Floor time falls under the category of developmental or social communication programs. And I can talk about this a little bit since we just referenced ABA, but on the spectrum of behavioral therapies, you are going to find ABA on one end, and then possibly something like RDI on the other end. And the difference between those is that ABA is a more structured program. ABA is a more structured program and is really based on, in the traditional sense, stimulus response. Okay, so it may be the therapist at the table with the child, and she asks the child a question, the child answers, and there's a reinforcement. And again, I'm oversimplifying just to highlight the differences. It's structured, it's clinician directed, there are specific activities utilized. Floor time falls under the other end of the treatment spectrum, which is a social communication, so it's very child-centered and child-directed. The child initiates, the parent responds, and builds on those children's behaviors. So it's different in its approach because it's more natural. ABA has been criticized because of the structure of the sessions does not always allow for generalization, whereas your social engagement programs are more natural and are designed to be elicited in more natural contexts. So you tend to get more generalization in those situations. So that's really the big difference there. And I have to say there's so many programs now that fall in the middle that you get little bits of ABA with some of these more natural approaches. And again, just to assume your child's best for one or the other, I would say somewhat of an eclectic approach, but still an intensive approach is important.